You now have 90 seconds to read questions 37 to 42.
Hello, I'm Michael Evans. I want to tell you about the work we're doing on a condition that affects 1 in 10 people in this country, and that's osteoarthritis. Osteoarthritis typically affects the knees, hips or hands when the cartilage that lines the joints starts to wear away. So how can we help patients with osteoarthritis? When I was at medical school, and that's a long time ago now, the theory was that it was due to wear and tear, an inevitable part of getting old. You still sometimes hear this, but it's one of the many myths about the condition. After all, we have teenagers who develop it, and every joint has the capacity for repair. So we should think of osteoarthritis as a situation where processes for tissue repair are overwhelmed by destructive processes that often relate to injury, weight, and mechanical load factors. But there are also other risk factors. Genetics may play an important role, and occupation makes a difference too, of course. Let's look at some more of the myths surrounding osteoarthritis. Osteoarthritis of the hands is an interesting case because this is one time you might think you can't put the blame on mechanical load factors. But you'd be wrong. There are actually circulating molecules that come from fat, and these influence the development of inflammation in joints. In fact, you're 30% more likely to get hand osteoarthritis if you're obese. And there are a couple of studies going on right now to test the theory that losing weight can have a positive effect on osteoarthritis in the hands. So what about knees? A lot of people say there are very high knee joint replacement rates in Australia, for example, because people do a lot of running in an attempt to keep fit. But this is another myth. In fact, studies show that for the majority of people, running's helpful in terms of stopping the onset of osteoarthritis. Though if you're a marathon runner, you do potentially place yourself at some risk. Now, if you've already got osteoarthritis and you want to take up running, the data's a bit conflicting. There are studies suggesting it can lead to exacerbations of the condition, but others suggest that patients who keep up their running do better at managing the condition than those who give it up. In fact, the sport that's often referred to as the knee surgeon's friend is netball. This is because it involves a lot of jumping, which puts pressure on the knee, which can cause a tear in the cruciate ligament, one of the main stabilising ligaments in the knee. This often leads to the development of knee osteoarthritis within 10 to 15 years. In the hope of preventing this, players may be encouraged to have surgery to repair the cruciate ligament. But in most cases, this is probably unnecessary, and it doesn't appear to change their long-term risk of developing osteoarthritis. The best way to prevent the problem arising is actually to teach players to jump and land in the right way. Unfortunately, whilst professional players get taught this neuromuscular technique, most ordinary players don't know about it. Now, let's move on to diagnosis. We have various imaging techniques such as X-ray and we have MRIs. For osteoarthritis of the knee, if an X-ray is going to show us anything at all, it must be a standing weight-bearing X-ray. But in most cases, it doesn't change what the doctor might do to the patient. We can diagnose by taking the history, assessing the symptoms, and examining the joint. And if someone of over 50 has an MRI scan, the likelihood is that it'll reveal a meniscal tear. That just happens as part and parcel of growing older, and it's not something that normally causes pain because a torn meniscus doesn't contain nerve fibres at that age. So it's just going to lead to unnecessary worry, and in most cases, intervention will do more harm than good. The next thing the patient wants to know is there a cure? Well, not yet. But recently there have been exciting developments in osteoarthritis treatment. People ask about stem cells, but at present they're unlikely to be any more helpful than a salt water injection into the knee because stem cell technology hasn't got far enough yet. But we're currently in the process of testing what we call disease-modifying osteoarthritis drugs that appear to be effective at regenerating joint tissues and reducing pain. And these will be injections a person gets into a joint maybe once every 12 months. But our main hope is that instead of turning to hip or knee replacements, patients can learn to control their condition through things like weight management and appropriate exercise.